Hello, I'm Tanushree Rao, and today I'd like to talk about modified hysteroscopy niche resection. This is an initial view of the hysteroscopy where the internal os is being seen, and then it leads on to the Caesarean scar niche. As you can see, there's quite a bit of volume to this niche, and you can see certain glands on the anterior aspect of the niche, which tend to release mucus and also aid in the formation of niche in the first place. Going ahead, we go into the uterine cavity, and doing an overall survey of the cavity leads us to visualization of the left ostia, and by just turning the camera lightly to 180 degrees, you can see the ostia on the other side, which is the right ostia. You pan back and get an overall view of the entire cavity as seen over here. The niche again is visualized. Let's have a look at that again. So going in, the niche is visualized along with the glands. That's the cavity. And then we pan back for an overall view. Now there are different ways to treat niche, especially if somebody has abnormal uterine bleeding. I've gone ahead and used a monopolar resectoscope using glycine as my medium. My setting is on 50 cutting and 40 coag. These are the phantom movements I just did, also known as practice movements, to see where I would be making my cuts. Once that's done, you go ahead and resect the caudal portion of the niche. So niche, if you can imagine a dome, has a cephalate portion and a caudal portion. When you review literature, you will find that some describe resecting both the cephalate and the caudal, and some only the caudal. In my experience, less is more, and I've always resected just the caudal version of the niche as demonstrated over here. I've also been comfortable using just the MyoSure on the saline and resecting the lower part of the niche. The idea is to flatten out this dome so that no blood continues to be collected. Now this lady had abnormal uterine bleeding and had classic symptoms of post-menstrual spotting. So in any woman who's had a history of previous 1, 2 or more cesarean sections, the minute they tell you, oh doctor, look, I've had a bit of spotting that doesn't seem to stop even after my periods have ended, you must think of a Caesarean scar niche. In the olden days, of course, the answer to any abnormal bleeding was hysterectomy. But we've moved on. We try to preserve the uterus as much as possible, and the indications for hysterectomy have actually reduced a lot. Now, this lady had heavy menstrual bleeding, so I've gone ahead and done a radiofrequency ablation of the uterine cavity, also known as the NovoSure, and also ablated part of the niche, so you can see the glands that were visible earlier are now completely ablated. This arrow depicts the leveling of the caudal part or the posterior part of the niche, which is in level with the internal os. Thank you for your patient hearing. I'll be back with more videos. Stay tuned.